you, Maya, for that lovely introduction, and I'm grateful for the opportunity to be here and talk to you all about the effects of a plant-based diet as it relates to cardiovascular disease. Okay, so today's talk, how to keep the beat going, because as we know, the heart is the strongest muscle in the body, and since we're so reliant upon it, absolutely essential that we do everything possible to keep it going. So this is a quote, that I think, is a nice lead-in or segue into what I'll be talking about by Dr. Caldwell Esselstyn. Some people think plant-based whole foods diet is extreme. 500,000 people a year will have their chest open up and a vein taken from their leg and sewn onto their coronary artery. Some people would call that extreme. And I agree. Why would you want surgery if you could reverse something using lifestyle changes? And so today's society, we're really living life to the fullest, literally. And so we don't want to end up in the stage as you see Leonard and Raj. And so how do we avoid that? Well, part of the thing is to try to address, what are the underlying problems. So let's see, moving to the next slide. Okay, so human evolution. It's really been a journey through time, and even more so, a journey through waistlines. Initially, things were moving in the right direction through the mid-20th century, and somewhere along that line, things start to go, fall off in the wrong way. And as you see now, people have evolved to be pursuing a lifestyle more based on the standard Western diet, being sedentary, thinking, okay, when can I get my next McDonald's? Not the way to go. We have to find a way to go back in time to the healthier days, healthier eating habits. Basically how our previous generations, great-grandparents and before, how they were eating. So cardiovascular disease is the leading cause of death in the United States. These are statistics from 2022 and 2023, which shows consistently it's still higher than cancer. And the cost of treating cardiovascular disease is anticipated to increase to $1.8 trillion by the year 2050. $1.8 trillion, which is a huge number. And again, most of the cardiovascular disease that we see is preventable. And it's unfortunate because our healthcare system now, it's really a sick care system. Healthcare is really supposed to be about preventing disease so that way we can live, longer and high quality of life. But instead of that, it's just a reactive system to where we're putting Band-Aids and patches, once patients have run into issues. So that's one of the failings of the current system. So today I'll be focusing on coronary artery disease, heart failure, and cardiac arrhythmias. Although you also will include stroke and peripheral vascular disease, but all are part of the same mechanisms and components in the cardiovascular system. So this is not the response that we want when we talk about a healthier diet. For lunch, I had a bottle of root beer, a bag of potato chips, and 2 candy bars. Giving up red meat is easier than I thought. Well, we'll actually see why this is not the right way of thinking. So there was a study done by Santhisri et al. In 2017 where they looked at, this was like tens of thousands of patients, both men and women, who didn't have significant cardiovascular disease at baseline. And they divided them up to 3 different groups. One was the standard animal-based diet. One was a healthy whole foods plant-based diet, and whole foods plant-based diet being where you not only are completely plant-based without any animal products, but you minimize the intake of oils, and sugars and all the junky stuff. And then the third group was the unhealthy plant-based diet, which is basically you include the processed foods and all the junky foods. And so what they found, interestingly, is that, well, it wasn't surprising that the healthy plant-based group did the best in terms of lowering their risk for coronary artery disease. But what was surprising is the group that did the unhealthy plant-based diet actually did even a little bit worse than the animal-based diet group. And so that really underscores the fact that it's not enough to just be plant-based, That's the first step, but you really have to avoid the processed foods and really try to minimize, saturated fats, sugars, oils. Those are all the things that'll do damage to the body. So this is leading into why consider a whole food plant-based diet. Again, heart disease is the leading cause of mortality, and greater than 80% is preventable. And so even though we're looking at the diet aspect of it today, it's also important to address not being sedentary and not being a couch potato and trying to minimize stress. And of course, stress can be hard, if you live in bedrock and you're working for Mr. Slate, but that's another story. So what happens with aging? Well, with aging, we get what's called inflammaging in the heart. This does occur, to different organ systems, but the focus being on the heart today. So what inflammaging is referring to is as we age, then you start getting chronic low levels of inflammation that build up in the body. So it becomes even more important that you try to do everything you can to counteract those effects. And so what happens with inflammaging is you get oxidative stress. So what does that mean? Well, when you have certain chemical reactions in the body, normally as part of that, you have free oxygen radicals, which are compounds that contain oxygen, but also have at least one unpaired free electron. At a certain level, it's okay because then the body can use antioxidants to try to neutralize that. But when that builds up, then those free radicals become damaging. They damage the DNA, the proteins, your cells in the body. And that's what oxidative stress is. You have increased levels of inflammatory molecules like CRP and adhesion molecules that will recruit immune system cells to places you don't necessarily want it to be. And then you have a remodeling of all the lipids in the body and peroxidation of that because of the free radicals. You also get epigenetic alterations. And so epigenetic alterations are alterations that occur to the DNA without actually changing the sequence of the DNA itself. And so one way that could happen is through microRNAs, which are small non-coding segments that basically will affect gene transcription. And then the inflammasome is also an important part. The inflammasome is basically part of the innate immune system, which is our first defense against invaders. And basically that's a complex of proteins involved in the inflammatory pathways, and that gets upregulated as well. And finally, cytokines, which are part of the immune system, like interleukin-1 and tumor necrosis factor, and those will lead to unwanted, again, inflammation. So this translates to then atherosclerosis and also heart failure, and as well as increased risk of arrhythmias or abnormal heart rhythms, such as atrial fibrillation. So, animal-based diets, why are they bad for you? Well, one, processed meats are carcinogenic. When heating them, they produce nitroso compounds and also heterocyclic aromatic amines, which are known to be carcinogens. In addition to that, they contain saturated fats. The human body does not need any saturated fats. And so saturated fats, as I'll show in subsequent slides, are very detrimental. Trans fats as well they're even worse than saturated fats. And even though nowadays they're limited or not found much anymore in our processed foods, but even in meats, they can be present in small quantities because they're naturally produced by ruminant animals in their stomachs. And then animal-based diets, well, they contain cholesterol. This, whether it includes meat or dairy, compared to plant-based products. Plant-based foods, they do not have any cholesterol. And then with animal-based diets, you get much lower fiber. And you also have higher salt amounts, and so that's not good for your high blood pressure. And then they contain low magnesium levels. And magnesium is a critical component in terms of calcium and also keeping your blood vessels relaxed. Animal-based diets are much more calorie dense on average compared to a plant-based diet. And they actually can cause an increased iron load, which can lead to something called ferroptosis, which I will touch upon in a subsequent slide. In addition, animal-based diets, when you take meats, for example, and you cook them on dry heat, such as broiling or baking or grilling, then that results in something called advanced glycation end products, or AGEs. And that basically occurs when you have sugars that react with proteins and carbs to form these compounds called AGEs. And those, again, will lead to inflammation and oxidative stress. And then animal-based diets, they result in higher TMAO levels. This I will touch upon as well in a subsequent slide, but those higher TMAO levels are known to be associated with an increased risk of coronary artery disease. And then also, when you think about fish, because a lot of people will say that, okay, well, I'm not eating red meats, but I'm only eating fish in my diet. Well, whether you're doing fish or chicken or red meats, they all will lead to production of oxidized LDL, which is the key part of atherosclerosis. So it's bad for you on that level. And in addition to that, with fish, they can contain higher levels of toxins or heavy metals such as lead, mercury, and cadmium. And that's because when through human activities such as agriculture we pollute the oceans, then that's what the fish are ingesting. And so then when a person eats the fish, then that's how they can get those toxic chemicals or metals. And then also it's easier to have chronic dehydration on an animal-based diet because with fruits and vegetables, you have much higher levels of water present within them. And so when I say chronic dehydration, it doesn't necessarily mean that you'll walk around feeling dehydrated, but on the inside, the cells, they're really needing, those extra levels of hydration. And what happens if you don't have that hydration? Well, one is it leads to faster aging. And then number two is that it makes the blood more viscous. And so if the blood is more viscous, then you have increased shear stress on the blood vessel walls, and that can make it easier for processes such as atherosclerosis to occur. So this is just kind of reiterating again how animal-based diets lead to cardiovascular disease. And so when you consume animal foods, one of the things that happen is they influence our gut microbiome. Well, what's our gut microbiome? Those are the microorganisms that live in our gut. And by the way, if you take the number of cells of the microorganisms in the gut, they're much higher than the number of cells of that human body itself, which is kind of amazing to think about. But they consist of bacteria, protozoa, fungi, and viruses. And so if you eat animal-based foods, then that leads to an imbalance or shift towards the more harmful or pathogenic bacteria in the gut. On the other hand, if you focus on healthy plant-based foods, then that leads towards a balance of the more healthy bacteria. And so otherwise, it's a delicate homeostasis or balance that goes on. So what happens if you eat animal-based products is you lead a shift towards harmful bacteria, such as Shigella, for example, or E. coli, and then they will release their endotoxins, such as lipopolysaccharide or LPS. That's normally part of the cell walls of or cell membranes in gram-negative bacteria, and those will translocate out of the intestine and cause inflammation and damage to the areas in the body. We also touched already upon the fact that animal-based diets will lead to higher levels of oxidized LDL. You also get excess production of free fatty acids, which we'll be going over very shortly, why that's bad for you. And then also you have upregulation of the renin-angiotensin system, which is in the kidneys. Now that's important because that helps to regulate the blood pressure. You may have heard of medications to treat high blood pressure like lisinopril or losartan. They work to try to block that renin-angiotensin system. So with animal-based diets, you're kind of going the other way, which you don't want. And again, animal-based diets will lead to higher levels of TMAO or trimethylamine N-oxide. So I just wanted to quickly touch upon the role of TLRs in cardiovascular disease. Those are toll-like receptors. They're part of the innate immune system or first defense. And basically, those will lead to, they'll take the negative compounds like the bacterial endotoxins or oxidized LDL, and that will lead to oxidative stress, and it will also upregulate inflammatory pathways such as that controlled by NF-kappa B. And again, that also leads to endothelial cell dysfunction and atherosclerosis and heart failure. So now this is the slide on the lipotoxicity. When you have too many saturated fats, then you get saturated free fatty acid overproduction, and then those get oxidized, and it leads to basically again decreased levels of nitric oxide, increased oxidative stress, and upregulation of the renin-angiotensin system, which again leads to cardiovascular disease. So again, you kind of see a theme here, how all of the things that we're talking about, it's ultimately leading to increased inflammation and oxidative stress as the underpinnings. So we talked about AGEs earlier, the advanced glycation end products. So when those get produced, then they get taken up by the RAGE receptors within cells, and this again goes down the same inflammatory pathway we saw before, NF-kappa B, and again it leads to reactive oxygen species. And also, when you get these amyl-based compounds going into the cells, that also results in mitochondrial dysfunction. And that's bad because a lot of the oxidative reactions that occur within the cells are within the mitochondria. And so when they become dysregulated, that's going to be a high source for developing free radicals that will damage, again, the DNA, proteins, etc. So this is a study that was done by Dr. Bernard's group showing the effect of a whole food plant-based diet on AGEs. And basically this had 244 patients. And what they showed is that if you look at the intervention group, which was the whole food plant-based group, versus the control group, the standard diet, there was a big difference in the dietary AGEs that get produced. And so again, that just emphasizes that you really have to consider not only the quality of the foods that you eat, meaning, again, not enough just to be plant-based. You want to make sure you avoid the processed foods, the sugars, oils, etc., but also the cooking method, that you use makes a big difference. Try to minimize dry heating, and doing more like stewing, for example, is one way you could reduce the AGEs. Of course, if you do it raw, even better. And one way you could do it raw is sprouting, actually, sprouting seeds. You can keep a lot of the nutrients within the vegetables, for example. Okay, so and then this is just illustrating the cumulative effects of animal product consumption. So when you look at the standard American diet, you take in the Coca-Cola, you take in the burger and the fries, and then after you consume it, then you have an increase in all the harmful compounds we talked about, but it's not like they'll go away after a few hours. It's going to build up cumulatively over time. And you can imagine that by repeating that over many years, that's the reason why we have such prevalence of cardiovascular disease in our society and other diseases, which frankly we shouldn't have if we were able to adhere to a healthy lifestyle and healthy diet. Okay, so this is again just touching upon the benefits of a whole food plant-based diet, which we already covered a lot of already. Other things too is you have with the microbiome, you shape it to be much more healthy, and you have increased production of short-chain fatty acids such as butyrates, acetate, and propionate. And those will help to counteract inflammation and oxidative stress and help support endothelial function. And basically, you also will have decrease in insulin resistance and also decreased hemoglobin A1C. Okay, so now to be healthy, you can absolutely do a whole food plant-based diet and still be Mr. Universe in 2014 and be one of the world's top bodybuilders. This is Bruce, which I'll show you another slide later on, but he basically kind of exemplifies that, a whole food plant-based diet. And so anyone who says that you can't do that and still be healthy, that's just one example, and also many other athletes included. So not all protein is created equal. We already talked about the differences between animal protein and plant protein, and a couple of other things I wanted to touch upon were with animal protein, it's more calorie rich. You also get higher phosphorus levels. And what happens when you have higher phosphorus levels? You get higher amounts of fibroblast growth factor 23, which actually controls both vitamin D and phosphate levels. And so higher FGF23 levels have been linked to increased risk of coronary artery disease and cardiovascular disease. Also, animal protein contains heme iron. heme iron is bad for you compared to plant-based protein, which would have, or plant-based products which have non-heme iron. So with our human bodies, we can regulate non-heme iron. The body doesn't have a problem keeping it at the right level. But with heme iron, it's not able to regulate that. So if you give it more heme iron, it'll just get overloaded. And then what happens with that is it can lead to something called ferroptosis, which is a type of programmed cell death that occurs when you have iron load and you also have lipid peroxidation. And so suffice to say that heme iron, and studies have shown that this has also been linked to higher risk of cardiovascular disease. And higher levels of TMAO. So TMAO is produced when you ingest animal foods, and they contain molecules such as choline and L-carnitine. And that gets metabolized by the gut microbiota to the trimethylamine oxide. And that again leads then to increased platelet hyperreactivity. It increases your inflammation, and it has negative effects on the cholesterol transport. And ultimately, again, it leads to atherosclerosis and heart failure. In fact, studies show that a higher TMAO level is linked to a higher risk of a cardiovascular disease. Whereas with plant-based diets, they actually lower the TMAO levels. And that is presumably done because of the microbiota, how they shape the types of bacteria that are down there to be ones that are more beneficial. Okay, so this is just touching upon dysbiosis and cardiovascular disease. It's basically what we've touched upon. Dysbiosis is when you have the balance of the microbiota in the gut tipped toward the harmful bacteria as opposed to the beneficial bacteria. And as part of that, when you get the balance toward the wrong direction, you can also get increased production of secondary bile acids in the gut, and which can have untoward effects on inflammation, and can become easier also for the harmful bacteria to be able to not only increase intestinal permeability, but to be able to allow the immune system to come in where it really shouldn't be, or being overactive and then translocate out, and can also lead to autoimmune disease. Okay, so I will go past this slide because it's just basically a summarization of everything we've talked about, the influence of the diet that we eat on the gut microbiota and how that affects the risk for coronary artery disease. And just to mention here, the short-chain fatty acids that get produced by the good bacteria have beneficial effects, such as lowering the blood pressure. Okay, so dairy. Why is dairy bad for you? So one is it's a high source of sugar. It has lactose, which is made of glucose plus galactose, and it also has saturated fat. Again, we don't need saturated fat in the body. The two essential fatty acids we really need are those from the omega-3 and omega-6 group. And so they also, dairy products contain cholesterol and hormones. Well, when you think about it, how does milk get produced? It's basically made by pregnant female cows. And so then they're constantly being stimulated and have high levels of estrogen in the body. And so that estrogen hormone is coming in. In addition, when the cows are being pumped for their milk, which in itself is a very sad and really cruel industry, to be frank, but they use mechanical machines to milk those cows, which become painful. And so then you get repeated inflammation, on the udder or on the teats, which lead to infection. And so then to try to counteract that infection, then they're fed, given antibiotics. Those antibiotics get into the milk. And not only that, but pus from the infection itself gets into the milk. So if you think about it, you're getting sugar, you're getting saturated fat, you're getting cholesterol, you're getting estrogen, you're getting pus, and you have increased cancer risk, prostate cancer, breast cancer, and ovarian cancer. So all, I think, very good reasons to stay away from dairy products. And cheese especially, it's concentrated like 7 to 8 times compared to dairy milk. So even worse on all those levels. So, and then I won't spend too much time on this slide, but this is basically a study that was done back in 2024 comparing dairy versus plant milks. Now, I will say that on plant milks, I would avoid coconut milk and anything made from palm, because those have a higher level of saturated fats. But other than that, the plant-based milks are going to be a much better bet if you want milk products. And so because with the dairy milk, you have higher levels of lipids and cholesterol and increased atherogenicity. And by the way, one of the things you hear often is, well, how do I get my calcium? Well, if you want to get calcium, you don't have to get it from milk. Actually, there are smarter ways of getting it from other foods. If you want to enjoy milk, you can for the taste, but I would suggest to stick to the plant-based milks other than the coconut milk or palm milk. But they're much better sources of calcium, like chia seeds and sesame seeds, and then your green cruciferous vegetables and almonds. Okay, so now olive oil. I know that's a lot of people love oil. Oil adds a lot of seasoning and a taste to our food. I know it's hard to give up, and this gentleman certainly is enjoying his share. But is that really good for you? Well, this was a study done by Dr. Agarwal's group from the University of South Florida, where they looked at about 40 patients, and they placed them in two different groups. Basically, both groups were sticking to a whole food plant-based diet, but they basically adjusted the levels of extra virgin olive oil. So the low extra virgin olive oil group, no more than 1 teaspoon per day, and the high extra virgin olive oil group, no more than 4 teaspoons per day. So they had them do this for 4 weeks, then gave them a break of a week, and then switched groups to see what would happen. And to summarize, what happened is it was shown that the low extra virgin olive oil group actually did much better in terms of lowering their level of LDL cholesterol, total cholesterol, triglycerides, ApoB, and the high sensitivity CRP and IL-6, which is a marker of inflammation. So basically on all levels, what this is telling is that if you really wanted to use olive oil, I would stick to the minimal possible amount, because the higher that you have, it's also extremely calorie dense, and again, it still will contain saturated fatty acids, which you don't need to add to the body. And so this is just showing kind of the differences between the vegetable oils. Just you can ignore the lard and the butter fat that was included in this, but you can see coconut oil and palm oil at the bottom have very high levels of saturated fat, so you really want to avoid those. But nonetheless, all the oils still will have some saturated fat, which are the red bars on here. And then you can compare like oleic acid, which is an omega-9 fatty acid that's more neutral in terms of the effects on the body, between the omega-3 and the omega-6. Omega-6 fatty acids, those are easy to get in your diet. You don't really have to work at it. You just have to make sure you get enough of the omega-3s. And so that's the key really to focus on. So, and this is just touching upon the essential fatty acid pathways. And so basically on the left, you have the omega-6 pathway, and on the right, you have the omega-3 fatty acid pathway. So the omega-6 fatty acid pathway starts with linoleic acid, which then gets converted to arachidonic acid, and that leads to production of inflammatory compounds, or inflammatory prostaglandins, leukotrienes, etc., and that leads to oxidative stress. On the right, the omega-3 series, which starts with alpha-linolenic acid, that does the opposite. That ultimately will lead to production of EPA and DHA, and it leads to anti-inflammatory compounds, and it counteracts the excess oxidative stress. But the thing you have to realize is that both of these pathways, they share key enzymes. There's delta-6 and delta-5 desaturase enzymes. So what happens is, based on what you feed into the diet, that determines which pathway wins out, because they're competing for the same enzyme. And so if you give a diet that's high in saturated fats, then that will shift things through the omega-6 pathway and more inflammation. So if you feed it healthy foods, they'll shift things toward the omega-3 fatty acid pathway and anti-inflammatory compounds and antioxidants, which is what you want. And the other thing, too, I just want to mention is that when you think about insulin resistance, the problem there is not as much the sugar. It's the fact that if you're giving it too much of the saturated fats, then that actually makes it harder for the insulin receptors to work the way they're supposed to. So glucose then doesn't get taken up into cells. So that really is what's driving that. So really, to try to treat insulin resistance, a key part of that has to be you have got to minimize the saturated fats coming into the diet. So now we're going to move to phytonutrients, such as polyphenols are one big class of that. Examples of that include a turmeric or quercetin, for example. Many classes here, as you can see. So the effects of polyphenols, what they do is they aid in antioxidant defense, and they basically reduce oxidative stress, and that helps to prevent, or at least slow down aging and cardiovascular disease. And so they do this by many ways. Here, this is just showing a couple of examples. On the left, you have curcumin, and on the right, you have quercetin, which actually is found in high levels, for example, in onions. And by the way, quercetin is also good for anyone who has histamine intolerance and who has to be on a low histamine diet. So curcumin, it has antiarrhythmic effects, prevents abnormal heart rhythm issues. It helps to regulate the blood pressure, and it has protective effects in the heart. It's an antioxidant, and it helps to support the endothelial cells. Quercetin also has anti-inflammatory effects, and it also helps as well to reduce risk of arrhythmias and reduce also hypertrophy of the heart cells, and it helps with the mitochondrial function. So cruciferous vegetables such as broccoli, kale, bok choy, etc. So they also contain essential phytonutrients. There's a class of compounds called glucosinolones, of which one you may have heard of, sulforaphane. And so compounds like that, what they do is, as shown in this picture, on the right, it's inhibiting the inflammatory pathway, which is being mediated by NF-kappa B. We've seen that before. And then on the left side, it helps to activate the anti-inflammatory pathway mediated by NRF2. And that leads to then antioxidants and reduced risk then of coronary artery disease. So this is a good New Year's resolution, right? I've got to start a diet and start exercising. Yeah, right. Ozempic, here I come. I can't tell you how many patients that I see in the clinic who would rather take a drug like Ozempic rather than trying to address things through lifestyle and diet. I mean, medications like Ozempic, that's not a long-term solution. And even once you stop taking it, the weight will come back. And in any case, there is no such thing as a benign medicine, including Tylenol. So if you can reduce your risk of cardiovascular disease with diet, exercise, decreased stress, no smoking, that is absolutely the way you should go. So don't be like this guy. Okay, so the aging heart. We've kind of touched upon this as far as the things that lead to aging and inflammation, or inflammaging, I should say. So that results in shortening of telomeres, which are repetitive sequences at the end of the chromosomes. It can lead to epigenetic alterations and the chronic inflammation, and also impairment of the stem cell function. With time, the endothelial cells, which are the cells that line the interior of the blood vessels, they will not be able to be replaced as well because the stem cell turnover becomes less. So atherosclerosis progression, we talked about how oxidized LDL, that basically leads to formation of plaques. Then that results in recruitment of the immune system, such as macrophages, which eat the oxidized cholesterol, and then that also triggers other inflammatory cells to come in, and basically then results in buildup of plaque and a fibrous cap over it, and then sometimes you can have rupture of that plaque, which leads to a heart attack, basically. And so, again, you want to try to prevent this from happening. Atherosclerosis is not a relentless disease. Many times it can be reversible, or at the least, it can be halted in its tracks. So this basically is a study that you may be familiar with, done by Dr. Dean Ornish. And basically it showed that in 48 patients, they showed how doing intensive lifestyle changes, not only a whole food plant-based diet, but exercise, reducing stress, that all actually resulted in reversal of coronary artery disease. On the right, it basically shows that when these patients' arteries were checked after the lifestyle changes were implemented, that they had a significant reduction in their plaques, or the size of their plaques. So again, just to emphasize, you can reverse the coronary artery disease. So, and this is an image from Dr. Esselstyn. It was a patient of his, actually a physician, who was relatively young, and on the left showed how he had significant coronary artery disease and symptoms from that. And then after 32 months of doing a whole food plant-based diet, because he didn't want to do medications or any procedural intervention. On the right, it actually shows how that healed back up. You don't see the plaques there anymore. And so it's, again, yet another example how doing a lifestyle change, if you're really committed to it, can result in such dramatic improvement. And always, diet and lifestyle will do much more for you than any single drug would. Now, a way to reverse, coronary artery disease. Again, this study was done by Dr. Esselstyn, a long time ago, looking at 198 patients, but again, showing that you had improvement, a lower risk of cardiovascular disease events in those adhering, to the plant-based diet, whole food plant-based diet, and lifestyle changes. So, and then this is looking at heart failure. So there haven't been a whole lot of studies done looking at a whole food plant-based intervention. So there needs to be more studies done on that. But this is basically showing on the right the studies that have been done up to basically 3 months of it, that you had significant improvement in their symptoms and also improvement in their ejection fraction. Again, all of this is coming down to you reducing, the inflammation, oxidative stress, et cetera, which underpin all of these disease processes. So now, atrial fibrillation. It's the most common, arrhythmia that we see. 60 million cases worldwide, associated with up to a 2x increase in heart failure and death. And it's also associated with a 5-fold increase in risk of stroke, as well as blood clots. And so, to try to reduce atrial fibrillation, the best way we can do that is to reduce the risk factors associated with it, which are high blood pressure, diabetes, coronary artery disease, congestive heart failure, obstructive sleep apnea, and obesity. And guess what? All the things that we've been talking about, that is the way to reduce all those risk factors, which will then reduce the risk of atrial fibrillation developing to begin with. So remodeling leading to development of atrial fibrillation. So basically, you have the risk factors we talk about, a dysfunctional microbiota from a bad diet, and that leads to production of inflammatory compounds such as IL-1, angiotensin II, TNF, etc. And then that leads to activation of the NLRP3 inflammasome. So remember, the inflammasome was that complex involved in the innate immune system. It's also part of that NF-kappa B pathway. And so when that gets upregulated, then you get fibrosis and scarring. You get changes in the ion channels in the cells. So the electrical properties change. And this all basically makes it easier then for development of arrhythmias, such as atrial fibrillation, or AFib for short. And so this is just touching upon, again, oxidative dysfunction due to diet. With the Western diet, you increase oxidative stress, and then you get first electrophysiological dysfunction. So for example, you get calcium overload, and that leads ultimately to changes in how the heart's pumping function occurs. So when you think of the heart's pumping function, it's not like going like this. It actually is a twisting motion of the heart, like you're wringing a rag. And so then what happens is, when that changes, those are subtle or key markers that the heart is starting to fail even before the heart's pumping function itself gets weakened. And then once you see those changes happen, then you see the more obvious structural changes that can occur and lead to a weak heart and coronary artery disease. So again, doing a whole food plant-based diet can help reverse these kind of changes. And a big part of this is also driven by dysfunction of the mitochondria itself, just because of the oxidative stress from a Western diet. So, well, nearly at the end. So, epigenetic alterations in AFib. So, we talked about epigenetic alterations that basically are changes to the DNA that occur without affecting the underlying DNA sequence itself. One way is DNA methylation in places where you have rich cytosine or guanine nucleotides, microRNAs, which we talked about, and then histone modification, which are the proteins that help to tie up the chromosomes. So you can have acetylation, you can have methylation, and ubiquitination of the histones themselves. That leads again to first electrical remodeling, then structural remodeling, and then leads to atrial fibrillation. So I just want to show you these maps real quick. So these are patients that I've done, ablation on for atrial fibrillation. But if you look at the color coding, the top left is one patient and the bottom right is a different patient. So the color coding is showing the voltage scale of the tissue in the top left chamber of the heart. So basically, you can think of like Roy G. Biv. So in this case, the purple is healthy tissue. Red means electrically there's no activity, it's like scar, and anything in between purple and red is abnormal. Now on the top right, you can ignore the red because that's the area where we isolated or cauterized the triggers for AFib, so you want that to be electrically silent, so that's okay in that case. But the purple you see in the top left, that's healthy tissue. So that patient's left atrium, the chamber affected by AFib, wasn't bad. But on the bottom right, you'll see that patient, their left atrium, you see pretty much all red and scar. This is a person who's had AFib for a long period of time. So this is an example of what will happen to the heart and other organs in the body over time, such a dramatic difference between the two. Okay, so it's the second to last slide. So basically, this is just a brief look at epigenetic remodeling versus the epigenetic clock. So as we age, you have changes in the methylation patterns of the DNA. And basically, there have been databases created to store that information and machine learning algorithms being applied to kind of help determine, okay, based on a person's DNA methylation pattern, what is the biological age of the cells in their body? Because a person's chronological age doesn't necessarily translate to their biological age. And so that's the epigenetic clock, or one way to do it. And so you want the epigenetic remodeling to occur in a way over time where it's beneficial, where it doesn't lead to aging as quickly. And so on the right, you can kind of see that difference. So what you see in the exterior, that's kind of what's happening for the organs as well. So as we mentioned now, the beat must go on. So again, if I haven't emphasized it enough, we need to focus on doing a whole food plant-based diet. And then, of course, exercise and relaxation. I guess Fred Flintstone must have retired by this point. So that's the direction we absolutely need to go. And there's no reason that we have to suffer with coronary artery disease, heart failure, diabetes. These are things that can be absolutely preventable. And for our children and future generations, we want to get them to where we don't see the obesity. I mean, I'll tell you, in my clinic nowadays, most of the patients I see are all either obese or overweight. It's such a rarity to see a patient even of a normal weight. And so it's kind of unfortunate when you know it's something that can be preventable. So this, I showed you his picture before. This is Barney Duplessis. And so he is the world's strongest plant eater. But basically, the caption at the top left, I think, captures things very well. The world's strongest animals are plant eaters: gorillas, buffaloes, elephants, and me. So basically, if our primates and other mammals who are much bigger than us do so well, on a whole food plant-based diet, there's no reason why we have to go outside of that. We need to go back to our roots and do really what nature provided for us. Nature is very smart and has provided for us what we need, and it's up to us, to make the best use of that. And thank you for your attention. I'm Santhisri Kodali. I'm a director of cardiac electrophysiology at Hannibal Regional Healthcare. Dr. Bandana and Manish Chawla kindly extended the invitation to me to come and speak at this event with the Peaceful Planet Foundation, which I'm grateful to be a part of. The most important thing that I want people to take away is the importance of lifestyle changes, including a whole food plant-based diet, in reversing cardiovascular disease. It is absolutely reversible, and I don't want people to think that they have to only rely upon traditional medicine, which a lot of times just relies upon doing Band-Aids and is reactive. Instead of that, being proactive and using measures that can actually reduce heart attack, heart rhythm issues, and coronary artery disease, heart failure. All of that can absolutely be accomplished with lifestyle changes, and that's the number one thing that I want people to take away.